Hello, hello. Welcome back to the podcast. It's your girl, Kamie Crawford. And today we have a leader in women's reproductive health, board certified naturopathic endocrinologist, founder of Brighten Essentials hormone support supplements, and author of Beyond the Pill. Her latest book, Is This Normal? Dr. Jolene Brighten. Welcome to the show.
Thank you so much for having me. I'm excited that we finally found time to connect.
I feel like your voice has been playing in my head for the past couple of months that I've been on this no birth control journey.
Mm-hmm.
And I just have to start off by thanking you so much for just easing my anxiety. I had so much anxiety about getting off the pill after 18 years. And I was searching high and low everywhere. I can't even tell you through TikToks, articles, Twitter, like trying to find information that would calm my nerves about this.
Mm-hmm.
And then I found you and I was like, thank God. Thank
Yeah,
God.
especially. Okay, so firstly, let me just receive that and say thank you so much for that. And this is something that I always just feel so honored to be a part of people's journey that, in writing books and having my website and having social media, that I'm actually, I get to have this kind of impact. So thank you for sharing that, because that
Yes.
always makes me really excited. And, it is something that I try to take a very middle of the road approach. Like, we need to be honest, we need to be forthcoming, we need to give informed consent about the pill and about everything that we do in medicine. And we need to remind people that there is a lot that they can be doing. In fact, the majority of things that are going to move the needle towards health, not one of them happens in a doctor's office. So
Hmm.
I am so glad to ease your anxiety, especially after you made a trip around TikTok, because the social media can get wild. I've actually seen more on Instagram than I have on TikTok in terms of just very wild
Dr.
ways.
Brighten, it got very dark for a second. I can't tell you, there were many tears were shed from the things that I was seeing on the internet, but like
Yeah.
also so thankful that we have the internet to be able to create
Mm-hmm.
communities like this and talk about things because even when I posted about getting off birth control, I had so much anxiety about posting about it because I was like, oh my God, the judgment, like people are going to be like, how could you stay on a medication for 18 years that, is a controversial topic. And I do want to
Mm-hmm.
also start off this episode by saying, someone wrote in and was just like, it feels irresponsible to have a conversation about getting off the pill when there are so many issues surrounding women's reproductive health that are going on right now and people trying to
Mm-hmm.
create laws to stop us from being able to protect ourselves the way that we feel is best for our own bodies. But what I love about your message is that this is not about fear mongering or surrounding the pill. You do have the autonomy to make the decisions that you want for your body, but you just need to
Mm-hmm.
educate yourself about what those decisions could mean and the long-term effects of that. And that's why I love you so much because I was just like, okay, like I don't feel the shame. And you repeat that over and over again. I listened to the audiobook. So you repeat that over and over again about like, this is not about shame. This is not to make you feel bad. Like, but let me give you the info and let me give you the real
Mm-hmm.
tea. And that is why we are here today. So,
Yeah. And I think that this is a great way to start this conversation because, one, we are facing a very uncertain time in women's health. And, it is something that when we saw Roe v. Wade get overturned, people automatically like had this, response that like now, we can't talk about anything really women's medicine that they might take away from us. And
mm,
I mean, what's crazy to me is I think about like I will always remember where I was when I read that. Like I remember where I was, I remember how I felt when, and I was actually overseas when I read Roe v. Wade had been overturned. And
mm,
so I think it's had this a major impact in the way that we look at everything now. And I totally understand people being like, well, you don't want to talk about it because we don't want them to take away the pill. Like they can use
right.
that as fuel for this fire. And at the same time, that's a very slippery slope because it has always been under the guise that this is what's best for women. And for people
Mm-hmm.
who can't see, I'm doing air quotes, best for women. Therefore, we withhold information. Like, it's best that we just tell women you can get pregnant any time of the month or
Mm-hmm.
any day of your cycle. And yet when she tries to get pregnant, she's met with that heartache, and it's not true.
Yeah.
That's concerning. But to the point of birth control, I just want to be very specific that I'm not anti-birth control. I will always advocate for access to birth control. And I can list so many reasons why women need to have access to this and why it's a medical necessity. But at the end of the day, I really believe that it should always be your choice.
Yes.
And you don't need a reason.
Right.
You don't need to share it with anybody. Like, spoiler, people don't owe you an explanation about their medical decisions, and yet they should be given the autonomy to make those. So I just want to, I want to honor that. Yes, it is scary times that we're
Mm-hmm.
living in, and it can feel that way. But does not warrant withholding information from women because, if you tell her this, then like, what if? And yes, these things are concerning, and at the same time, we have to be honest with women.
Yes. Amen. Amen. Preach on. That is exactly how I feel. It doesn't mean that we withhold information. If anything, we need all of the information because it is that important. We put out a poll to our listeners to ask them, what are your feelings about the pill? Are you on the pill?
Mm-hmm.
And it's interesting because 45% of our listeners say that they are on the pill, but 46% of our listeners say that they also want to get off of the pill. 20% say that they're on the fence. And there are a lot of people who enjoyed the pill. I myself loved being on the pill because of the freedom that it gave me. I got on the pill originally because I had really painful cramps. And the
Mm-hmm.
doctors, from a young age, I was 13. I had just turned 13. I had just gotten my period and I was missing so much school. And at the time, it was like birth control pills were given out like candy. It was like, oh, you got acne? Here's a birth control pill. You got painful cramps? Here's a birth control pill. And instead of really diving into what the deeper issues could be, it was like, let's give you this thing. You're going to feel relief. And of course, myself, my family, I was missing so much class. My family was like, okay, let's sit down and talk about this as a family. But it then became the decision that I was going to get on the pill. And I'm
Mm-hmm.
grateful for the years that I had on the pill. I just wish that I knew more about it. I wish that I, at 13, was given some information that I don't know if I would have changed my mind about using it, but maybe I wouldn't have
Yeah.
used it for so long. I just find it very interesting that every time I would go to the doctor, even as an adult, the first question that my OBGYN would ask me is like, are you happy with your current birth control? And when I would say yes,
Mm-hmm.
we would just move on to the next thing. It was
Yeah.
never a conversation of like, well, just so you know, or there was never any kind of fear or just basic information given to me about,
Mm-hmm.
fertility or, well, how long have you been on it? Nobody ever questioned it. Why
Yeah.
are we not given more information when it comes to the pill?
Boy, so let's unpack all of this. So first things first, you're 13,
Hmm.
right? And you're in a lot of pain and you're missing school. And we know that missing school because of your period, well, missing school for any reason, but if your period's causing that, that can have a major impact on the total outcome of your life,
Yeah.
right? We don't want you missing school. We also don't want you in extreme pain or, so I resonate with your story a lot. I was 14, didn't start the pill until I was 17, extreme pain, more than 7 days of bleeding, missing school. And so in that moment, it's an easy thing to pass you the pill. And,
Mhm.
back then, the screening for endometriosis, which is one of the first little dings that should go off in a doctor's brain, it was only laparoscopy, which is a surgical intervention. Now we can actually do imaging, and there's other ways that if we suspect endometriosis, we can investigate that. This is what my issue is with the pill. Put you on it at 13, never question why you're on it, why they started you with it. Okay, what should have been said, and there's numerous things, right? I write a whole book about all the things that we should say, but what should definitely have been said is that this is treating your symptoms. We don't know what might be causing them. What's on my differential? Here's the different things I think this might be. The time of period we are, you're 13, and we don't want to do an exploratory surgery on a pelvis of someone this young who has a body still developing. And so this is something we should investigate in the future. That's really that's the ideal conversation, is giving you this option to get you out of pain. By the way, we can talk about other ways to manage pain for people who don't want to use the pill. But if that, I mean, at 13, you could talk to a 13-year-old about like taking magnesium and changing your diet, and that may or may not work. I don't know. I thought literally thought crumb donuts were acceptable as a lunch in high school. So I don't know,
Yeah.
but
Right.
you might have that teen and it works. But the whole point is that it should have been set up for you. And then somebody down the line should have been like, tell me your pill history. Why did you start the pill? Okay, because of that. Do you have any future fertility in mind? Yes or no doesn't matter in terms of we should investigate why you had such painful periods. But there's a lot of this, if it's not broke, don't fix it
Right.
mentality. And then there's the other thing, which is that the pill is just reflexively given to everybody. Now, in your case, in my case, it's like it can get you out of pain. Like your doctor doesn't want you in pain and they know it can help. That's great. It's great
Yeah.
for them to do that. But in other cases, as we see that 58% of women say they're using the pill primarily for symptom management and pregnancy prevention is like a secondary thing.
Mm.
That 58%, you'd be hard pressed not to find the doctors who are just frankly being lazy and just being like, here's a pill, and it prevents them and it keeps them from having to investigate and do their job. I'm not saying that like they're these evil doctors like conspiring, but it is something that unfortunately, doctors are stuck in a model where seeing 30 patients a day means that it's 5 minutes with that patient, and they've got to get in and get you solutions and get out fast.
Yeah.
And so before you blame your doctor, just recognize that we've got an entire systemic problem where we've got, for the first time in history, a pill that doesn't require a medical diagnosis. All it requires was, having ovaries. This is when the pill came out. First drug that 50% of the population qualifies for. Does it have benefits? Absolutely. Is it overused? And I wonder sometimes if we're going to look back and be like, remember how we were overusing antibiotics like crazy and throwing them at
Yeah.
everything? Like maybe we shouldn't have thrown the pill at everything. So that is really the crux of what I take issue with, is people not being given information about the body they live in and what could potentially come down the pipeline. And can I just share something personal
Yes.
quickly?
Oh my God,
Okay.
please.
So I was put on the pill, painful periods. I get off the pill. I talk about this in my book. I lost my period for several months. And that was after like clockwork. And the doctor, he was like, oh yeah, you probably had irregular periods to start. When I was like, my period's gone.
Mm.
And I just laugh and I'm like, if your period makes you vomit, okay,
Mm-hmm.
takes you out, you're on the floor with a heating pad, because like back in the day,
Me.
it was either a hot water bottle or a like tiny little heating pad cord, and you're like against the outlet, like
Yeah.
just in
Right.
so much pain. But I'm like, when it's doing that to you, you count it down like doomsday. Like I know it
Yeah.
was regular because I know the cadence in which my life was just horrible. And so I get my period back, yay, but it comes back like it had before. And it was
Mm.
horrific. And so that took a lot of hacking on my end using my nutrition background. I was in med school. And so going through all of that to really get those painful periods gone, get the bleeding in check. And once that I was able to do that, I went on, I had a baby at 31, I had a baby at 40. I subsequently, at 41, had 4 miscarriages. And I go
Mm.
through all this workup, and everybody just says, you're old, you're old, you're old. Does this resonate with anybody? Always getting dismissed. Like, even as a doctor, I'm going to doctors, and they're like, it's just because you're old. And I'm like, could we test
Mm.
things? Let's look at stuff. It's only after all of that that I get a full body MRI through Prunovo, and they're like, you have adenomyosis and endometriosis lesions here. You should be have further investigation. And I'm like, I had endometriosis. I had endometriosis when I was a teenager. I was
Mm.
put on the pill and I did it for a decade. And I had always said I didn't regret it because I'm a first generation college student. And that's one of the benefits
Mm-hmm.
that you get from the pill. And now I'm like, and this is like very raw for me because this was like literally like 6 months ago. And I'm like,
Wow.
so I'm that person I wrote about in my book. I never thought I'd be the person I wrote about in my book. But as it turns out, I have this chronic condition and nobody ever asked me about it. And because I was like not having any pain, had it in check, nobody thought to ever ask about it again, even though that's the whole reason why I started the pill. And to be
Wow.
fair to my doctors, I had 2 kids. I didn't have pain of any
Mm.
kind going on down there. So it wasn't highly suspicious at that point. And yet my story is in no way unique whatsoever. That women struggle. And this is the other thing about being 13. You're put on the pill and you're told, oh, yeah, you can come off at any time and you'll get pregnant.
Yes.
And that could be very well true at 13, at 23, at 33. But many women are delaying pregnancy. Sometimes they're like, I'm going to come off at like 38. And so people know there is an end to our biological window, and it isn't just a drop off at 35, right? We're all
Mm.
told like after 35, that's not
Yeah.
how it is. And so you may very well, I mean, I was 40 and had a baby. You may very well be able to have a healthy baby later, but if you have something underlying like polycystic ovarian syndrome or endometriosis, and that hasn't been worked on, you may not be able to, because those conditions were left to do what they do and you weren't actually being managed correctly.
Yeah. Oh my God. Well, first of all, thank you for sharing that because I know so many people are listening to this right now and like banging their head against the wall, like, yes, like this is what I've been dealing with.
Hmm.
And it's so disheartening. It's so shocking. I mean, I've, like I said, been listening to the book and I'm almost finished. But just listening to you talk about like how little advancement has been made to the pill over the years, and
Hmm.
yet how many complaints women have about using it, but they haven't fixed it. They're just like, well, it
Yeah.
fixes most things, so like you should be happy. And so many women are not happy. It's like,
Yeah.
what? Like, what is going on? Why is nobody listening to us? Why does no one
Yes.
listen to women? Why does no one listen to Black women? Why, like, it's
Yeah.
such a long-standing issue that is so much bigger than us, but the things that we can control, I think that we should try to. And so I'm so glad that you were able to find out your diagnosis after all this time. How has it now changed your life, or has it changed the supplements that you're taking or anything? Are you doing anything differently?
Yes, definitely. So it's something that I want people to understand, that with endometriosis and these complex chronic conditions, I can sit here and tell you all the things that work for me, and maybe 50%, maybe 90%, maybe 10% will work for you. And I want you to understand that doesn't mean you're broken or especially challenging. It's that we all have individual life factors.
Mm,
And because of that, when we approach, these kinds of conditions, different things work for different people. So I went through IVF because I was told I had to select for the best eggs. And after all of that, and a failed transfer, and I met with other this was like the worst part of all of it, is I met with 3 other reproductive endocrinologists who we already had the results of the endometriosis, and they all said it never was your eggs. You were getting pregnant successfully every time you tried, and you had, you made embryos and all this stuff. And they're like, it was that your endometriosis was missed. And I'm like, that just
mm,
gutted me. So it was after my 3rd egg retrieval that I was in the worst pain, the
mm.
worst pain. And I woke up in pain. I
Oof.
woke up like from the procedure, and I was like, in my head, I was like, oh, there was that whole Yale scandal of like the nurse stealing the pain meds. And like, did that happen to me? Because I'm in so much pain.
Yeah.
It was so bad. They had to do an ultrasound, a transvaginal ultrasound right there. They were like, there's a lot of blood in your
Wow.
cavity, which that is part of why endometriosis is so painful. And anyone who's ever experienced something like that understands. So it was just through all of that. Like, it took weeks and weeks to recover. And the only thing, that's offered is ibuprofen. And honestly, you don't want bigger gun drugs.
Yeah.
But at the same time, I was like, I was like, this is not even touching the pain. And I was like, something is definitely not right.
Mm,
And it was, it was weeks later, I ended up having the endo bloat, which is where
mm.
your abdomen is like completely distended. And I was in my head, I was like, is this is this what I think it is? And yeah, and then I started having like achy bladder and all these things. So for me, because I'm still in this fertility journey, I needed to do 2 months of Lupron. For people who don't know, what Lupron does is it takes you from being cyclical, fertile, hormone, you're bathing into menopause in about 2 weeks.
Oh my
And
God.
yeah, it is rough. I did it over the holidays too.
Ooh.
But I just needed to tank the hormones basically to shrink the lesions as fast as possible. If I wasn't trying to get pregnant, I would have done other things. I wouldn't have
Mm.
used such big guns, but it was just necessary for where things were at. I mean, how many people get to have like a 2 month window insight into what menopause is going to be like for them? I feel like I just got gifted with like, now I'm like, I talk about how I'm in menopause training
Oh
because
my
I'm like, that's
God.
like coming in like 10 years.
You've got a
So
crystal
like,
ball.
I know what it's going to be like, and
Yeah.
it's not going to stop, right? Like there's no like, oh, and then my
Mm.
hormones will come back. So
Mm-hmm.
that was the Lupron piece. But in addition to that, things that I talk a lot about that I tell like everyone is good for them is like 25 grams of fiber a day. I got really dialed in to making sure that I had as much diverse fiber as possible, that it was hitting 25 to 30 grams. Just so people know, if you go higher, like 30 and up, you can sometimes make it so that you affect your hormones in a negative way. You can start like tanking your estrogen. So more
Mm.
isn't necessarily better. But having variety of fiber. So what we understand about endometriosis is that it's likely an autoimmune condition. And most autoimmunity has some interplay, some origin in the gut. So there's the theory of how autoimmunity develops is you've got the genes, you have a triggering event, and your gut is highly permeable in what people often call leaky gut.
Mm-hmm. I
And
have that.
so, yeah, it's good times. But, I think that, as humans, we go in and out of that so much. It's just if things persist, right? Like,
Mm.
like if I had stayed with the NSAIDs and kept popping those and was still here, then leaky gut.
Yeah.
Hormonal birth control also can cause leaky gut.
I did not
There's,
realize that until I read your book. And I have done so much work, taken so many gut supplements, done so much for
yeah,
my digestion, started getting colonics, doing so many things for my gut. And when I heard that in your book, I almost crashed my car. I was like, are you fucking kidding me? Literally. Because even my gut doctor, who I love, he's helped me a lot
yeah.
to ease a lot of my symptoms. But he didn't even suggest that my birth control pill could possibly have something to do with it. It's
Yeah.
crazy.
Well, some providers, they don't totally subscribe to intestinal hyperpermeability or that it's problematic. There's lots of research out there. However, the birth control pill, because your gastroenterologist isn't managing your reproductive health, he's not going to probably talk about that, especially because if a doctor's going to tell you, hey, your birth control might be a problem, they also need to tell you, if you don't want to get pregnant, we need to get you a backup method. And that's not
Mm,
his wheelhouse so much. He also might not be, the thing about the pill is it's got like the best marketing in the world because it's got so many advocates out there that are like, you want to talk about the benefits of the pill, but if you bring up any concerns about the pill, it's but it
yeah.
helps women and it would hurt women if you took it away. And it's like, nobody's trying to take it away, friend. If anything, if you love the pill, I want you to be successful on the pill. Like
Yeah.
if I tell you it depletes nutrients, like really key ones that we need that make us feel good, like magnesium, zinc, selenium. So those are minerals that are needed for neurotransmitters and brain health and muscle function and your thyroid. And then I say, there's B vitamins as well and antioxidants, which also help keep like your eggs healthy and your heart healthy and your brain healthy. If I tell you all of that, that doesn't mean I'm trying to take away the pill. I'm telling you it because if you think that you're going to skirt by on a highly processed food diet and you're going to be on a medication that depletes nutrients, like
Mm-hmm.
it's not going to end well. So how about instead, if you're going to use the pill, we get you on a prenatal or multivitamin. There's been several researchers who have concluded that in their research when they look at this and they say, hey, this is just something providers should talk to them about. Like, just give them something that's kind of like an insurance policy, right? If you don't have the
Right.
best diet that day, hey, you got nutrients coming in. But, even more importantly, I think, is that we do talk about the diets. We talk about the fiber stuff. We talk about where are antioxidants found? Where can you be eating foods that get these minerals? That's something that is this normal? I put a whole table in there of like, here's the nutrients, here's how they affect hormones. These are the foods. Get into these foods and start incorporating them into your diet.
Yeah.
And so, and I'm sure, what's funny is that whenever I talk about that, so first I used to get backlash, and I would hear doctors be like, oh, it's not significant. It doesn't, no, she's making that up. It doesn't deplete nutrients. I'm like, when I was getting my nutrition degree, I remember the slide that was up there talking about all of the medications that deplete nutrients, and the pill was listed, oral contraceptive pill. And I remember sitting in class being like, "Oh, wait a minute, what? I'm on that.
Mm.
Like
Mm-hmm.
I'm not on metformin. I'm not on, these other things, but that,
Yeah.
yes, I am on that." And so we've known about this since the 1970s, and yet almost no provider is talking about it. And big part of that is because they don't have any nutrition education. They're
Mm-hmm.
like, that's not their wheelhouse. Your dietitian's more likely to talk to you about it. But what I've seen now evolve over the years is that now doctors will acknowledge it, but they say it's not that big of a deal. Just eat a standard diet. I'm like, hey, are you familiar with the standard American diet? Because if you
Yeah.
go into PubMed, if you look at the research, that's the bars on the floor. Like, you
Yeah.
want the worst diet in the world, standard American diet. Now compare everything to that, and everything else looks amazing, right?
Right.
Because yeah, eating people to eat a standard diet. I mean, when we consider less than 10% of people in the United States have a healthy metabolism, like that's enough said about our
Yeah.
food supply, like
Right.
what's going on. Not to mention all of the nutrients that are devoid, but tricking your brain. So I don't want anyone to feel shame here, because
Yeah.
understand. So I have a degree in food science and nutrition, and the whole food science aspect is how do you trick people's brain to believe they've done exactly what they've been designed to do. Seek out the most calorically dense food that is the easiest to attain, because in nature, that equals high nutrition value.
Mm.
But in a bag of whatever chips you want to name, like that does not equal high nutrition value. So you shouldn't be ashamed if you are eating processed food and you're loving it, because that's how it's designed.
Right.
It's just something that I want people to understand, that one, their body deserves better. They deserve better. And
Yeah.
two, that you're not going to get away with that being on medications that deplete those.
Yes. Well, my biggest thing with having this leaky gut issue, and I just was like, when I was having that problem specifically, I was going through a lot of stress. I wasn't thinking about the pill being a part of it, but as I was trying to work on my cortisol, like lowering my cortisol levels and all of that, I was just like, something else is wrong. I need to just do a restart. So I was like, I'm going to get off the pill, not because I'm ready to get pregnant right now, but just because I need to give my body a reboot. Like my body needs a
Mm-hmm.
break. And I was like, okay, well, how do you do that? Because I came across one of your videos and you were talking about getting off the pill cold turkey and like what that can do to your body and like really scare your body into some kind of crazy downward spiral. And I was like, okay, well, I don't want that. So what can I do? What can I take? And so when I started reading it and talking about just like gut repair and how it aids in all of these things, I was mind blown by all of the things that I did not know about what this medication. Of course, but then it was like, of
Mm-hmm.
course it's been doing this. 18 years of a long-term medication, anything can happen. I mean, you look at like topical steroids and the short-term use of that, what that can do for your body. So it definitely all correlates, and I wish more people knew that, more people in the medical industry, but like you said, a lot of it is designed to keep us going back to certain patterns and things. I do want to talk about what the pill does to your body because a lot of
Mm-hmm.
people had questions about what the pill does to your body while you're on it and what it can do to your body when you get off of it. A lot of people
Yeah.
got on the pill because of acne, because of either fibroids or, all kinds of different issues.
Yeah.
So when we are taking the pill, what is the purpose of it as far
Mm-hmm.
as what it tricks your brain into thinking that your body is doing? And then also,
Yeah.
what is it doing actually, chemically, physically to your body?
Mm-hmm. Yeah. So the way that the pill works is to flood your system with enough hormones that the brain gets basically shut down from communicating to your ovaries. And if the brain, the pituitary specifically, never sends out that signal to your ovaries, they will not produce hormones. And so essentially flatlines your hormones, and it prevents you from ovulating, which is great if you don't want a baby, right? Like, yay. That's a
Until,
fantastic mechanism.
yeah.
However, it also is going to decrease your testosterone as well. This is why women will report that they lose their libido on the pill, is because estrogen and testosterone have both come down. So it's not just your cyclical hormones of estrogen and progesterone, but estrogen and testosterone as well. And so we're not making any hormones. We're not ovulating. We're thickening the mucus so that if sperm is introduced, it has a really hard time swimming. Not a lot of them can make it there, and thinning the uterine lining. This is why you do need a period, but you don't need a pill bleed. And why I use that language very specifically is because calling everything a period is so confusing to
Yes.
people. And
Yes.
the reason why it's confusing is because you're on the pill and your doctor says, oh, you don't need a period. And then you come off and then you don't have a period. And you're like, well, my doctor said I don't need a period. Wait, that's
Yeah.
different, or you are somebody who has irregular cycles and usually acne. These are the two things that'll go together. We'll talk about that in a minute. And you're put on the pill and your doctor says, now you have a regular period. You're thinking, my periods have always been regular. You come off, your period goes missing, and you're like, hey,
Mm-hmm.
where's my period? And you tell this story of like 18 years I had a regular period, and your doctor's like, okay. And then you're like, yeah, and then I went off the pill and like now I don't have a period. And it's like, well, but back up, you never had a period.
Yeah.
You were having irregular periods, you never had a period, now you've come off. This makes a lot of sense for someone who had polycystic ovarian syndrome or PCOS, which
Mm.
leads me to the acne part, because that's the thing when you're like, oh, if you come off cold turkey and it's just like, so scary, it's acne.
Yeah.
That is the thing that is most terrifying for women. And when you are put on the pill for something like PCOS or having hormonal acne, it can help. It doesn't always help, but it can help. However, when you come off, that's where you said, thank goodness for the internet. I'm like, yeah, so many women sharing their stories. So, you're not alone, because there's so many out there. And I've seen
Yes.
it so many times where they come off, their face explodes, their back explodes, their butt explodes, like they are getting acne. And that makes them be like, I'm a slave to the pill. I have to stay on
Yeah.
this. And that's where I talk about, if you are on the pill for symptom management, start prepping your body 3 months in advance for that. Support your body, talk to your doctor about it. That way, when you come off, if these symptoms come up, they're coming back, you're getting investigated sooner, you can understand what's happening. But women are so much more successful when they do it that way than just stopping and then having that acne episode. I'm
Yeah.
somebody that, anyone who can see, I do not have acne. I never had chin acne, only when I came off the pill. And the iPhone had just come out. So like I didn't have one. We were documenting stuff. People were like, why don't you have photos of it? I'm like, who wants photos when they have cystic acne?
Right.
Like,
Yeah. Yeah.
and we didn't have
Selfieing it up.
iPhones.
Yeah.
Like I think we were just in the digital age. Like all of the like photo booths for film were disappearing. You guys, that's how old I am. Okay. And then you get to, so now, and it's so funny because people are like, oh, it probably was like, what, it was just that you had it all along. I had a lot of doctors online, like armchair diagnose me and say
Mm-hmm.
that it's not true. I actually needed to be on the pill for only 10 days for IVF. And I came off in cystic acne again, started up on my chin.
Mm.
I was like, I'm that person that this happens to. So, but
Yeah.
I will say, as a doctor, it makes you super empathetic, because you know that acne isn't just like, oh, you have these like benign skin lesions, you're not going to die from it. It is like, yeah, but I can't go out and I feel so ashamed of my face and
Yeah.
insecure that I feel like I am like socially, I'm dying right now. And so I definitely have a lot of empathy for that. So we
Yeah.
talked about, how the pill shuts down the ovaries, how it affects, those hormones, and then the acne component. But yeah, so I'm like, let me pause there, see if there's any questions.
I mean, everything that you're saying, I can completely resonate with, because I did not know, after being on birth control for 18 years, that all of the pill bleeds that I had, when you take those sugar pills, those placebo pills, I did not know that that was not a real period. I
And not
just found,
necessary. You
and
didn't
not
have to do
necessary. I didn't have to do it. And so when people like, sometimes, I would skip. Come on. If you're on the pill, you've skipped once or twice. I would skip because, I got vacation. I wanted, I don't
Oh,
want to, I'm
totally.
trying to get
I was like
laid.
an early, yeah, there's that. I was an
Yeah.
early adopter of, the seasonique. Like you just, you only
Yes.
have a period every quarter.
That's what I was on.
But yeah, and if people are like, well, why don't you need it? Because the endometrial lining is thin and you're not ovulating and you're not going through the cyclical hormones to stimulate the endometrial lining, the lining of
Yeah.
your uterus to build. Now, this is one of those, I said I could list so many reasons that to use the pill. This is another one of those, is that if you are someone who goes without a period for several months, that's going to be a really heavy period. That was like when I got my period back, that was the first thing that happened. I was like, oh, well, that could have been like some buildup. But then when it kept
Mm,
happening, I was like, there's worse.
yeah.
But endometrial hyperplasia can occur. And using the pill for just a short period of time to induce a bleed, that can be helpful because left untreated and the lining continues to be stimulated by estrogen, a year later, you are now getting atypical cells and perhaps you want to develop endometrial cancer. We don't
Mm,
want that. And
mm-hmm.
so, again, this is why I'm like, we can't have the pill go away like altogether,
Yeah.
because for some people, this is the most economical way to prevent endometrial cancer if their issue is, they're having these anovulatory cycles or issues with progesterone. Because the
Yeah.
reality is not everybody has the financial time or energetic means to employ all the things that it takes to heal your body from some of these conditions. And for
Yeah.
some people, the pill's like the best thing for them in that moment.
Right. Yeah. I mean, that's definitely what I thought until, a couple months ago before I got off the pill. Gosh, when was this? It must have been like January. I went to a fertility specialist. First, I went
Mhm.
to, let me tell you my story, Dr. Brighten. Let me tell you my testimony.
Say it. Let's hear it.
First, I went to my OBGYN, who I have now fired because she scared the shit out of me, frankly. I went to her because I just wanted to talk about family planning. I am in a very loving, happy relationship, and we're just talking about the future. And I said, I want to go to my OBGYN, see what's going on, talk about getting off the pill because I've been having all these gut issues. I go to my OBGYN, and she's like, we can do an AMH test on
Mhm.
you to see, what's going on with your ovaries, what's going on with your eggs. And I was like, okay,
Ma'am, were you on the pill and she ran
I
this
was
test?
on the pill.
Oh,
Dr. Brighton,
oh, we gotta talk about that.
when
Yeah.
she called me with the results, first of
She's
all,
like, it's like point two.
it
You
no,
never, you
it
never made
was
eggs.
literally, I think I was at a point nine, no, like point two. I don't even know. I washed it from my brain because I was like, it doesn't matter. Take it out of your
Yeah.
brain. Like, this is not a real number. She did not tell me that being on the pill would affect this hormone test.
Yeah.
I get the results
Which
from
for people
her.
listening, it's
Yeah.
not cheap, even if you
Yes.
do have insurance.
Yes, exactly. So she then is like, yeah, I mean, your results honestly are like really low. Like they're like a woman who's in her like mid 40s. Like they're just like really low. And she's just talking just like that. They're like really low. Like this is like for somebody who's in like menopause. I'm like, bitch, are you my
Did you
op?
just say you say menopause to me?
Are you my op or are you my gyno? Like, what is happening right now? She was like, yeah, it's just like really low. So, like, my advice to you is like, get off the pill and like hurry up and try to get pregnant or like freeze your eggs. And I was like, in tears, mind you. I'm in tears. I remember I was on the couch and I was just like, I was blubbering. I was like,
Oh
so
my
like what?
gosh.
So like I just need to get pregnant right now. She's like, yeah, like I would just try to get pregnant right away. And I was like, okay. And she was like, well, she was like, or you could freeze your eggs. Like, I froze my eggs because when I was your age, like my number was way lower than yours. And, I decided to freeze my eggs and it was the best decision I ever made. And I was like, oh, and like now you have like a like you've had healthy pregnancies since. And she's like, oh no, I don't have kids.
Story. Oh
I
God.
was like, click. What the fuck do you mean? I was just like, okay, I need a new advisor. I need somebody else. I then called one of my friends who has frozen her eggs and did get pregnant naturally. And she basically was like, you need to go to a fertility specialist. Like, stop crying. Book an appointment at a fertility specialist, have them give you a real exam. And that was
Yeah.
when I went to a fertility specialist in California. He did an intravaginal ultrasound And he informed me that my ovaries were really suppressed from not having had that communication for all those years.
Totally.
And
Yeah.
he
Not, you didn't even need an ultrasound. I
didn't
could
even
tell
need an
you that
ultrasound.
without
Didn't
the
even need it.
ultrasound.
Didn't even need it, but I wasn't even thinking that was the first time that I realized that I had
Yeah.
not ovulated in 18 years, that it was
Hmm.
never happening because I've never taken a break from the pill. That was the first time in my life that somebody had told me that. And
Yeah.
I will also say it was a very painful ultrasound because he was like, "I'm sorry, but, like, I'm
Oh
really
yeah,
trying to
you got to be
find."
like pushing, digging. Yeah. So people know the ovaries, like they're they don't look totally like the diagrams, but they're like off to the side towards your
Yeah,
hip bones in that direction, and there are organs. There is
yeah.
like intestines around, and so though you got to have your belly pushed on, and yeah, it's a
It
whole
was not the
thing.
vibe. It was not the vibe,
Yeah.
and he was just like he was like, "You gotta get off birth control. Like, if this is what you want, if kids are what you want, you've gotta get off birth control." He
Yeah.
didn't scare me, but he was just like, "This is the reality. Like, you're
Yeah.
31, and if you wanna do this, like, if you wanna freeze your eggs, great, but we gotta get you off the birth control, and you need to have 4 regular periods and then come back to me." I now have had my 4th period. I got my period back right away after getting off birth
Yeah.
control, but I know that that is
Nice.
also not the norm for everyone. Everyone is different, and I
Mhm.
honestly, I've never been so excited to get an actual period, but also just to bleed before in my life. I was like, "Thank you, God." Like, I felt so grateful. The second one, not so grateful, and
No.
then the 3rd one, not so grateful, and this last one, not so grateful. But I've just have really been thinking about how I just had no clue that that entire time, the bleeding that you're getting that you think is a period that was still painful, by the way. I still had cramps. I still
Mhm.
had, irritability. It was never a period.
Well, I wanna unpack this AMH thing because 'cause I'm sure people listening have a lot of questions.
Yeah.
I am so tempted to make a podcast on, like, tell me your bad gyno story
Yeah.
because they're not funny in the moment, but I am
Yeah.
just like this. I mean, we're laughing now, right? I
Yes.
think after
Yes.
the fact, but I'm like, I don't want to drag a whole profession because there's a lot of like awesome gynecologists
Yeah.
out there.
I have fired
But
2
I'm like, I
gynecologists.
just want to hear these stories, like
Yeah.
have these conversations. And shout out to reproductive endocrinologists because seriously, they're like MVPs of fertility. And I
Yeah.
just don't think enough gynecologists, like, instead of your gynecologist saying anything that she said, she should have just referred you. She should have been like,
Yes.
this
She
is
didn't.
low. Let me get you to a reproductive endocrinologist instead of being like, yeah, you should just like go try to have a baby now. Like,
She
did
sounded like a high school
like,
bully, honestly. I was like, "Are you kidding me right?" I never
oh,
wanna speak to her again, and then I got a
Regina,
text I
Regina.
Regina George. I got a text from her office being like, "If you like, can you please leave some feedback or like a rating for Doctor Blank?" I was like, "I 0 isn't even enough. 0 stars is
Oh
not even low
man.
enough,
Yeah.
girl."
The side eye.
Yeah.
So anti-Mullerian hormone, AMH. This is used as a marker in fertility. So you're looking at basically how many eggs you have in your savings account. And in your
Mhm.
checking account, you're out there spending them. And each month, there's a gaggle of eggs. Okay, I don't actually know what I'm like. We got to come up with a fun name for that, but there's a bunch of eggs, and
Yeah.
they're all getting ready.
Yeah.
And basically, the ovary has to pick its winner. And so one becomes the dominant follicle. Once it's mature enough, estrogen shoots up to the brain. Brain's like, got it, sends out the LH, luteinizing hormone. That hits the ovary releases the egg. I like to say, like, LH is like the release the egg, but in the release the Kraken voice, release the
Yes.
egg.
Yes.
And then the egg is released. And what follows that spot where the follicle was is the corpus luteum. That's going to secrete your progesterone, taking you into your luteal phase. So that's what's happening when you're not on the pill. And AMH is trying to gauge like all of these eggs that you have that you're getting ready each month, like only one wins. And how much of those do we have? Now, once we enter into menopause, this is what we're thinking right now. Research might say otherwise because there's some longevity people doing research and the things are like, I got questions about
Yeah.
stem cells and ovaries. But what we believe now is that you deplete those eggs, right? You lose those eggs and then you enter into menopause, because the brain's going to tell. So perimenopause, the brain is like, this is where FSH, if anyone's ever had follicle stimulating hormone measured, and it might be like sky high, like shooting off. That's because the brain is yelling at the ovaries, being like, do your job. And the
Mm,
ovaries like, I ain't got no eggs for you. Like, leave me alone. Get off my
mm.
back. Like, and maybe I'll make estrogen. Maybe I won't. We'll see what if I feel it. Do you know that employee
Yeah.
that's got one foot out the door? That's your ovaries in
Yeah.
perimenopause. They're like, I'm about to retire. Okay. I see the cake. Martha's bringing the cake already. I
Yes.
don't need to do
I'm
this
out.
anymore.
Yeah.
So with AMH, this is often, so people will get this done sometimes because they want to see like what's their egg reserve. You know, if we see that if the number is 4 or higher, we start thinking polycystic ovarian syndrome. So it has utility in that way as well. But especially for IVF, they're going to measure your AMH, because if you're going to do an egg retrieval, they want to know, is it worth putting you through this? A low
Mhm.
AMH is usually a no. You've got to find a special provider that wants to work with you. And that really, gets that there's ways that you can, there are providers who do it, but I've seen patients who they're like, yeah, my doctor said my AMH is too low. They will not do an egg retrieval because they're like, what are we going to get? 2, 3
Mm.
eggs, and they might not be that good. So that's what goes into the decision-making with AMH. We don't measure it when we are on the pill or anything that would suppress ovarian hormone function. So the reason is because they're basically put, like I think about all the sci-fi movies where like, you go in the cryo and you just like chill for a bit and then they
Yeah.
like wake you up later. That's being on the pill. Ovaries, you're in the cryo. Okay. When we need
Yes.
you, we're gonna wake you up. And
Yeah.
that's what's happening. And so they will shrink because they're not being stimulated. So, and Beyond the Pill, my other book, I talk about how like Kim Kardashian, like she just got drugged by the media because she said, I think it being on the pill aged my ovaries.
Mm.
And oh my God, doctors were like ripping her apart, hating on her. Like, don't tell women that about the pill, right? You're going to scare women off of it.
Yeah.
Why did nobody? I'm like, no, but hold up.
Yeah.
That is a true experience for her because, okay, I want everyone to listen. The pill does not age your ovaries, but if you're on it and you get an ultrasound and an AMH, they look old AF.
Yes.
Okay, they look
Yes.
old.
Yeah.
I kind of hate that because, like, right, I said that's common for me in 10 years. But anyhow, like reproductive years, we
Yes.
don't got like 80 plus years. Okay, so
Yes.
like you got to deal, it's like dog year math for the ovaries.
Yeah.
Okay, like
Exactly. Exactly.
they're much more advanced.
Yeah.
So we don't measure an AMH. We don't do transvaginal ultrasound to look at ovaries when somebody's on the pill. It's at least 3 months, which is like getting 3 cycles. And
Mm-hmm.
then you would go back to your doctor and you want to see and your doctor, the other reason why I really like that he's like, get 4 periods and then come see me is because he's going to know, were they consistent? Were they showing that that's a great like time period for a set of data.
Yeah.
And he didn't tell you just wait 6 months and keep trying, but he's like, let me actually help you with this. So
Yes.
being off the pill, and then going in and then get your ultrasound, then get your AMH. Day 2, 2, 3, 4, but usually 2 or 3 of the cycle. So day 1 is your period. That's usually when your ovaries are going to be looked at because then they can see how many follicles are developing. How many potential eggs do we have? By the way, IVF is going to try to save all of those. The egg whisperer, Dr. Amy, I love that she says that she saves eggs. So sometimes people are like,
Mm.
oh, it depletes depletes your ovarian reserve faster. Those eggs were going to die. They were all going to
Mm.
die. They only get 1. You
Mm.
might have had like 10 between the ovaries. And what IVF does is get more and try to save as many of those eggs as possible.
Yeah.
And so just so we're clear, everybody, the pill does not age your ovaries, but it will make them look old if you go to running tests. You shouldn't do those tests. Don't do
Yeah.
them during that. We know what it's going to be like. And secondly, IVF does not rob you of your future fertility or put you into menopause sooner. We have no evidence of that. So I feel like those are 2 myths to unpack in all of that. So
Yeah.
now you're on your journey. You going to go back and you're going to see him and get worked up again?
Yeah, that's my plan. That's my plan. I also want to touch on Kim Kardashian because, well, not touch on her physically, although maybe. But
Sometimes she wears outfits. I am not gonna like. I know everybody loves to hate everything she wears. I think I just am. I'm fascinated by some of these things, but some of her outfits just look like they're so soft to be in. I'm like, I do
Yes.
want to touch that.
Skims is
So I
amazing.
will give you that.
I'm wearing Skims as we speak. But also this is not an ad for Kim Kardashian. I feel that she is often the right message. She often has the right message, but she's the wrong messenger. When she said nobody wants to work these
Mm,
days, that was real. She just was the wrong
yeah.
person to maybe say it. When she says that the birth control made her ovaries look old, almost correct message, but wrong messenger, I
Yeah.
suppose, because people just are not willing to listen. But she's talking about some real shit, people, because that's basically what happened to me. And
Yeah.
now I'm hopeful. I definitely cried even after that appointment, although he was so gentle and lovely.
Hmm.
But just because like it's so scary that as women, even as young girls, we grow up thinking like, oh, one day I'm gonna grow up and I'm gonna get pregnant. And it's just like you don't ever think one day I'm gonna grow up and I might have fertility issues
Yeah.
and I might have to go through 3 rounds of IVF and I might have failed retrievals and I might have you don't think about those things. It's just
No.
an automatic, this is what I'm gonna grow up and be able to do. And for me, I'm the oldest of 6 girls. My mom, we have a blended family, but my mom had five five healthy pregnancies. The last two were natural twins at 40 years old. Like I've
Hmm.
never thought that I would have any kind of issue. Um, and I don't know that I am going to have an issue, but I do know that
Yeah.
birth control and long-term use of the pill can have effects. And even when it comes to being able to have a healthy egg retrieval, being able to have a healthy pregnancy, being able to feel good postpartum, hormone regulation, from what I've learned from your book, is vital to all of that.
Hmm.
The risk of miscarriage and all of these things. Like hormone regulation is the key to a happy life, just in general. And we have a lot of people who wrote in and were worried about weight gain, getting off of the
Yeah.
pill, or even just someone was like, am I going to go insane? Like, am I going to go insane when I get off of it?
Yeah.
What are your feelings about those things? And how
Okay.
can people regulate that early?
Two different topics here. So weight gain and am I going to lose my mind?
Yeah.
And I do want to say, just to your point, I know exactly that feeling. Like I never wanted to have kids. And then when I came off the pill, I had no period and I knew what that meant. That was the
Mm.
moment where I'm like, well, it hits different when you don't have the choice, when
Yes.
like you feel like you no longer have the choice. And I feel like a lot of women, they go through that and not because the pill caused their infertility, but because the pill was a tool that they used, but maybe the person giving it to them didn't disclose that it was really masking whatever else was going on. And
Yeah.
so that's why it's always, I just really love when providers ask people, how do you like your current contraception? Are you planning on having children? Should we have that conversation?
Mhm.
Because you can, if somebody says, like, yes, is that 3 years? Is that 5 years? Like, what are we looking at? That way we start to get a plan. And there are great kind of gynecologists out there doing that. So if I was doing my podcast, I was like, I have to have the good ones too.
Yeah.
So it
Yes.
doesn't feel dire.
Yes.
But to the weight, actually a lot of women report losing weight when they come off of the pill.
Yeah. I feel
And
like my
that,
face has slimmed down way. I felt like I
mhm.
had like a moon face before, and now I feel like I have a little bit more of an almond face. Upside down almond. I don't know. I
Yeah,
feel
well,
like
your
it's helped.
estrogen's shifting. You now got rid of progestin. You're going to be bringing in progesterone instead. So that can affect fluid. And if you come off the pill and you feel like, oh, I'm gaining weight, I'm not going to say, like, I don't want anyone to take this as like, oh, you're just eating too much. That's not what I'm saying. But what I am saying is that when you start cycling, progesterone makes you a little less sensitive to insulin, and it can increase caloric requirements like 5%. Some people, like athletes, see like 10% more. And that can happen for 2 weeks out of the month. So
Mm.
you may be actually consuming more carbs than you were before. For some people, the pill also makes them nauseous. And so they are
Mm.
actually eating more. But it's just paying attention to those things. I'm going to start my period here in like a few days. And I ate some chocolate last night. And I told my husband, I'm like, I know that chocolate helps with neurotransmitters. Like I could tell you all these things. I can also
Yeah.
tell you all the benefits. We should all eat chocolate. I think it's great.
Yes. Yes.
However, I told him, I'm like, but let me just say that chocolate never tastes better than when you're like in that, what would be the PMS window, right?
Yeah.
Like chocolate never tastes better. And it's because you're less insulin sensitive. Whereas estrogen takes a back seat, serotonin and dopamine do as well. And so then you get this like little hit and it
Mhm.
is like, oh, so good. So I
Yeah.
just want people to know that
Yeah.
all of that is working and conspiring in some ways. But God,
Yes.
I'm
So
like,
good.
as I talk about this and like had that experience last night, I'm like, no, truly, that's my reason for like not wanting to be back on the pill. Cause God, chocolate,
Yeah.
you did so good. Like, I
Yes.
just love that. This is a joke, everybody. I'm
It
making a
hits
joke here.
different though. It hits different.
It does. It
It
does.
does.
Okay. So, and then talking about like feeling like I'm losing my mind. Okay. So, um, being on the pill can make you feel like you're losing your mind coming off of it may make you feel that way as well. And you
Mm.
need to talk to your provider if either are true for you. And if they say it has nothing to do with the pill, it's just blah, 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 it's in your head, like go get a different provider. Like
Yeah.
you're going to have to get a different provider. Now, what I want people to understand about if you had something like PMDD, and which is like you take PMS and you just like you jack it up on steroids
Right.
because these are people that can have real suicidal thoughts. They can try to take their own life, or they're having extreme rage. They're having all
Mm.
kinds of pain. Like these symptoms are they're really pronounced and they're debilitating. And
Yeah.
that is one of the times that sometimes the pill can help with that because there is a subset of people. So progesterone should make you feel really chill, calm, help you sleep at night. There is a subset of people who maybe progesterone is not doing that for them, is making them feel these extremes, or just shifting hormones can make you feel those extremes. If you are somebody with that, and you're like, I want to come off the pill, it can be done, but you definitely want to work with a provider because you don't want things to get really scary really quick.
Yeah.
The other thing that I will say is that there is a very high association of autistic women having PMDD and
Mm.
those with ADHD having PMDD. Now, I say this because not every woman who has PMDD is neurodivergent,
Mm-hmm.
but if you have, at least we know for autism and ADHD, if you have either of those, you're very high risk of PMDD. So if your doctor has been like, you have PMDD, here's this medication, understand you may very well be autistic or have ADHD,
Mm.
in which case that medication is only going to do so much for your moods. And you're going to find other times where you're dysregulated because our whole society is set up to be productivity first and humans never.
Yeah.
Like really, I
Yeah.
think a human experience
Yes.
is like never, right?
Yes.
So I just want people to understand that because when it's so hard in the United States because I'm always like, meet with a provider because that's a responsible thing to do and that's what's really going to help. But not everybody has access to that. But
Yeah.
it is really just important for you to understand this additional information because if you're coming off the pill and you're like, well, now all of the time I'm feeling all of these things, like my senses are up, understand it could be something more. You had mentioned about your cortisol earlier on. What's
Mm-hmm.
interesting about being on the pill is that your cortisol response can be blunted, similar to that of those with PTSD.
Mm.
And like I'm just going to say this is the other thing that never really comes in this conversation, but by way of being Black and being a woman in America, you already have a disproportionate allostatic load, this
Tell me
higher
about
amount
it.
of stress, yeah, that's on
Tell
your
me about
system.
it.
And
Yes.
so we don't have a study on this. We don't have a study on like, well, what happens if you have high ACE scores, so adverse childhood events, or a high allostatic load, and you're on a medication like the pill that blunts your response to cortisol? Like
Mm.
what happens to the
Mm-hmm.
system? We don't actually know. And this is where, we have to talk to the individual and meet where the individual is at. And so it is like, as you come off the pill, by the way, these things can resolve. This is
Yeah.
not all doom and gloom. But when you come off the pill, you may be feeling like the effects of stress and your whole HPA, which is the hypothalamic pituitary axis, how your adrenals and your brain are talking, that system also has to recalibrate
Mm-hmm.
itself. And
Yeah.
so, but I will say that there is this language, which I find so interesting. When there is a pattern and enough women are saying it, it really baffles me how people don't pay attention of like
Yeah.
when people use language, and often what they say is that it's like they were in a fog and they stepped out. or clouds parted, or suddenly they were just like in cotton, and
Yes,
they have like
yes.
pushed. I had a patient say that I pushed my way out.
Yeah.
This feeling of when you come off the pill, you are sensing the world so much more. You have so much more clarity. You're in tune with yourself so much more. And so I say that because I did just like go on this whole, like, it could be this bad thing and make sure that you have, but it could also be this
Yeah.
really amazing transformative thing as well.
Yeah.
When I was started talking about all of this like a decade ago, and I would talk about how hormones affect the brain. And man, I was funny. I even think about like the gynecologist who would like push back and be like, don't say that because with women's lib, we've had to fight so hard. And like, you're just reducing women to like, oh, you're just hormonal. And I'm like, well, we are hormonal and
We
that's
are.
cool and awesome. And like,
Yeah.
it brings a lot of superpowers. But I realized that like these older generations, like they definitely had a different experience. And like they've
Yeah.
got like that really like old school feminism vibe, which is just like step on anyone and anything to make sure that we advance this movement, including those people who are saying things like the pill doesn't work for me, or I'm, this isn't helpful. And now we're just seeing such an explosion in research because, and I think because thank you, the internet, and how many women out there, I mean, especially menopause, how many women out there are telling their stories. And now we are
Yes.
seeing so much more research being done, so many more people talking about it. You were saying as a little girl, nobody thinks about like, I'm going to grow up, I'm going to have to do IVF, I'm going to do all these, like, because we don't talk about it. Yeah, I don't want
Yes.
little girls having to dream about doing IVF. I've done it. I
Right.
don't recommend it to little girls to be dreaming. Okay.
Yeah.
That's not what I'm saying. But what I am saying is that like we have to normalize these conversations, and that's
Yeah.
part of how we advance things in women's medicine. And we have to not be running scared with a mind of what ifs. What if we are honest? What if we share? What could happen to us? So we have to be talking about things. And I agree that we also need to do it in a very nuanced way.
Yeah. Well, I love that you give grace to the previous generations because I think that there is definitely grace to be given. They did have to do so much work just for the pill to even come to pass. So I can appreciate that. But we had people write
Mm-hmm.
in like, how is it that so many millennials are coming out with their stories about being on birth control for the past 20 years? It's like we're all getting off birth control after 2 decades
Mm-hmm.
because it was just so normalized. And I love that so many people are coming out and talking about it. I'm glad that I came out and spoke about it because I found so much community. We got so many questions about this topic, and we're not going to even remotely have time to get to all of them. I feel like we answered a lot of them, but I am just shocked at and hopeful for the future because of how many people who are talking about these things, talking about PMDD. I mean, back in the day, they used to throw women in homes for hysteria and saying that we
Oh
were
yeah.
all crazy for having PMS symptoms. But then we hear about PMDD and we're like, yeah, there are people who have an even worse time with these kinds of symptoms. I personally getting off birth control and now like being in my body for the first real time. It's so interesting because I think I've talked about this before, but I have a friend who's currently transitioning, and we were talking because she's been on hormones, and it's like we're both dealing with the same things. Like, because she's like, she calls them her moans. So she's like, girl, I'm on the moans. I'm like sweating. I'm like, my boobs hurt. I'm like, bitch, my boobs hurt. Like, what's going on? Because when I got off the pill, I thought I was going to have that,
Oh
like,
man.
coming through the forest, like, oh my God, everything is so shiny and rainbows. And that's not what I felt. I felt
Yeah.
the worst brain fog of my life. I could not put a couple words together to string together
Mm-hmm.
a sentence, and it took a while. Now I'm feeling more like myself, but even the little things like the ovulation pain. I remember the first time I felt the ovulation pain, I was like, "Whoa, like what are those zaps?" I haven't felt that. I don't even remember the last time I felt that.
Yeah.
It's literally like I describe it as not like your brain and your ovaries are two former best friends that have not spoken in 18 years for me personally, because that's how long I've been on birth control. And
Yeah.
now they're talking and they're like, wait,
Yeah.
you're a mom now? Wait, okay, so wait, you live where? You moved to Texas? Like, when did you, like, they're communicating for the first time in my life. And it is like, it's very,
Yeah.
very weird. And they kind of have beef. Like, they're trying to like suss each other out, What I also wasn't expecting, Dr. Brighton, was the libido. Oh my God. I love my boyfriend. I always want to have sex with him. But when I got off birth control, I have never felt so ravenous. I thought I was going to like physically attack him throughout like a week period. I was like, oh, but not attack him in a bad way, y'all. Attack him like I wanted to rip his clothes off. Like I felt it was crazy. I was like, my nipples, everything, they were so sensitive. Everything just felt so sensitive. And
Hmm.
from reading your book, I realized how our libido is suppressed on the pill. And so many women think that they like don't find their partner attractive when they get off of the pill because the pill made them think that they liked one person. It's crazy, but it's
Yeah.
common. It happens all the time. And nobody but you is talking about it.
It's
So,
wild that
yeah.
Dr. Sarah Hill, everybody, Dr. Sarah Hill is another. She's talking about it, and she actually talks a lot about the so what you just touched on, mate selection,
Mhm.
attraction, and as well as the cortisol science in her book. This Your Brain on Birth Control. And she's a PhD researcher in the field. And I just love her. She's brilliant. But the wild thing is how so like we're not supposed to talk about how our hormones can affect our brain. Now we understand that like, oh, they do amazing things for our brain. It's like, yeah, the thing that we always do is reduce women to just reproductive health and capacity. Like that needs to go away because these
Mhm.
hormones, they're everywhere in the body. There's receptors everywhere. They're doing marvelous things. So now we see all this research that's like the hormones do affect your brain and your brain changes throughout the month. But like there's all of these like really amazing things that come out of that. I think if you view everything through a capitalistic lens of like produce, 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 then it seems like a burden because the entire system is based on a man's 24-hour clock and we've got a roughly 28, 30-day clock. And so
Yeah.
there's nothing wrong with you at all. You're like trying to fit into a system that wasn't totally made for you, really wasn't made for you in terms of
Yeah.
the fact that you have to cycle. And we're seeing like a lot more research around these topics. The other thing that we're not allowed to talk about is the homemade selection piece. God, the way that gets shut down so fast.
Mhm.
Because sure, like how do you do studies on this? The studies are like not phenomenal, not amazing. Like, there are studies where they're like, hey, look at these pictures of a man and we're going to give him more feminine characteristics, which is like less of that broad jawline. Like, you just like, I talk about like, think about Gaston,
Yeah.
right? By the way, he was the worst. I
He was the
like said this
worst.
in an interview and I was like talking about Gaston and somebody commented and they're like, okay, obviously she didn't get that movie. She's a Gaston fan. I'm like, nobody's a Gaston
Nobody's a
fan.
Gaston fan.
Zero, literally nobody.
Nobody.
Gaston is the reason why women choose the bear. Okay. It's Gaston.
Yes. Yes.
Like it's
It's
Gaston. So,
Gaston.
but they did make him like the whole point of that was to make him characteristically irresistible and beautiful, right? So then the beast is like, very
Yeah.
beastly.
Yeah.
So anyhow, those kinds of features, because he sings a whole song, you guys,
Yeah.
about his face and
Yeah.
like what is great about him.
No
They
one
show
looks
women
like
those
Gaston.
features.
No one fights like Gaston.
Yeah,
All the
right.
things.
You know
I
it.
know it.
So, you show women who are cyclical that, and they're going to choose the more masculine features. Like these are things that we've seen. We know for research that, if you're a stripper, you get tipped better around ovulation. So,
Oh
that says
shit.
something.
I didn't
Yeah,
know that.
right. Yeah. So, oh
Okay,
gosh. Okay, guys,
girls.
here's like a hack. Like you got to photo shoot, you got to do videos, any of that, try to do it around ovulation, like leading up to ovulation, not like, oh, I might ovulate today, like schedule it a bit before because
Mm,
estrogen is going to rise as soon as you start your period. The ovaries already get on their baby making agenda. Brain's conspiring, uterus is like, I'm still bleeding. They're like, you're out. We're not talking to you right now. So
yeah.
ovaries do their thing. They start to kick off that estrogen. When you get near ovulation, estrogen is going to really peak. That is where your brain is going to be amazing in what it can do. You're going to be like, oh, I'm on top of my game, like everything is going great. You're also going to find you have less fine lines and wrinkles. So your skin's going to look
Mm.
plumper, your lips are going to look plumper, your curves are going to look more curvier. And this is generally when people like will report that they feel the most beautiful, they feel so confident. It's also when they're most in the mood for sex, because estrogen is like sex on the brain. Testosterone's important too, but for women, estrogen is like you're fantasizing, you're thinking about sex. It's helping the nipples. It's helping with
Mhm.
arousal, which is the clitoris getting engorged, lubrication, and it helps with orgasm. So estrogen doing all these amazing things.
Yeah.
So that is the trick. That is when you want to like photo shoots, have like anything that you're like, I need to feel beautiful and confident, because estrogen, testosterone, they're gonna be riding with you. They're gonna be your besties and they're gonna make
Mm.
you feel that way. When you past ovulation and hit that progesterone about like 5 to 7 days post ovulation, your progesterone's going to spike. And that's where you're going to be like, I'm feeling kind of gassy. I'm not feeling
Mm.
so like, this is,
Mhm.
I'm feeling like not feeling myself in the way that I just was. And that's normal. That's the way
Mm.
that things are supposed to flow and all of that. We were talking about Gaston though, and the strippers and people getting,
Yes.
so anyhow, there is all this research out there that's like maybe cyclical women and non-cyclical women choose different partners, like that based on scent, based on all of these things. Immediately critics are like, that could never be a thing. But if they just spent time listening to women, there's a lot of women who have these stories. There's a lot of
Yeah.
women who are like, I was on the pill, came off of it, no longer interested in my partner. Listen, when you throw in the dynamic though of like you were with someone for 10 years and you chose them and you were on the pill when you were with them for 10 years, and like all of life is happening, it's hard to be like, oh, that was just the pill, and not necessarily like life happened. So
Mhm.
that's all to say that if that's true for you and that's how you feel, then like that's true for you. We honor
Yeah.
that. And where it is with the research is like, well, maybe, but like it's a hard thing to measure and know without a shadow of a doubt that that is the thing.
Yeah. Well, let me tell you something. I had another gynecologist that I also fired.
The guidance stories.
This is a different, no, this is a different one. This is the first one that I
I
fired.
this is
I have
guidance
not,
story too.
I have not had good luck in LA with gynos. I had a great gyno when I was in New York. In LA, I don't know what's going on with these people. But anyway, I went to her. This actually was a good thing that she did for me. I went to her for like my annual, and I was telling her I was in a different relationship. And I was telling her, I was like, God, I think I might need to change my pill. Like, I'm having a lot of difficulties with arousal. Like, I'm not getting wet at all. It is Sahara Desert down there,
Yeah.
and I don't know what's going on. And she was like, How long have you been on this pill? And at that time, I think I had been on it for like, I don't know, 12 years, 14 years maybe. And she was like,
Hmm.
I don't think it's the pill. That's the
Yeah.
problem. And I was like, Oh, oh, and she was right. It was the man. So thank you very much to, to her for her help in that area. But I do think that there is something to it. And if women are saying it, I'm assuming the critics that are saying that this is not accurate are men.
No, actually, this is the really interesting thing. So, if, of course, there's like men out there, but I think men are quicker to be like, see, it wasn't me, it was the pill. Like, it was the
Mm,
pill.
hmm.
But the thing that I see is a lot of women, and it's just really disheartening to me. So, I just had a comment the other day that I saw, and this woman was talking about how she went to her doctor and like she's in menopause, she's having all these symptoms, and her doctor, who's a woman, just says like, this is the way it is, you need to suck it up, tough it
Mm,
out. And it was really sad, like everything she was dealing with. But the thing that struck me was the person who replied and said the call is coming from inside the house. And I'm like, if it isn't, if I don't hear from patients all the time who are like, I feel like my doctor hates me, and she's a
mm,
woman,
hmm.
and people being like, how often really the call is coming from inside the house.
Yeah.
And I think like, look, some people do just suck. Maybe they do. Because I know someone's
Yeah.
going to be like, you're giving them too much. But I do think this also, again, comes back to that place of like, we feel like the pill is something that like it could be taken away from us. Like,
Hmm.
it's like your favorite toy, but it's the thing that might be used as punishment or taken away. And so these kinds of criticisms, they're really quick to dismiss. It's also why we still have so many doctors who will not recognize the potential that the pill is influencing someone's mood in a negative way. We have
Mhm.
lots of research studies. We didn't even need them because we've had, I mean, we do. Okay. But like
Yeah.
we could have listened to the person in front of us.
Right.
That's my point, is that if they say everything was fine, I started this pill, now I'm crying all the time and I'm not fine, then we need to say, okay, well, this sounds like it's true for you. So let's investigate what else is going on. Maybe it might be something else, maybe to be the pill. But if you can't be a curious scientist and open to all possibilities, and you just shut down anything that makes you feel uncomfortable, like you might lose access to the pill if we talk about it or question it, that's really problematic. And I think the other thing too, so I just want to note that I don't think a lot of people realize that the pill, feminists are like, how hard we had to fight for the pill. And I'm like, do you not actually understand the history of the pill, that it
Mm.
was actually brought to the island of Puerto Rico? Women were exploited. They died. They were coerced into doing this. And then even after the pill was made available, it was made so unaffordable that the women on the island couldn't access it. So therefore, they ended up going on to suffer from forced hysterectomies and having the
Mm.
largest, highest forced sterilization rate of any population in the country. That is how we got the pill. And that is something that like I always just kind of take issue with when people are like, oh, but like, do you know what feminists had to do? And I'm like, do you know what the brown bodies you exploited had to go through? Like, do we
Mm.
talk about that at all?
Mm.
Because that's a very real thing that happened. And I think that we can and why I bring it up is because people are like, why even talk about that? Like people will use that as fuel. And I mean, because those women always deserve to be honored. Like,
Yes.
I'm the first generation college student, so grateful that the pill existed, was even an option. And yet we can't just like erase that part and act like they didn't give like everything
Yeah.
for all of us.
Yeah. I mean, it's ooh, Dr. Bright, I want to be your best friend. We could talk for 5 million years because even when it comes to Black women and the mortality rate, when it comes to Black mothers, and the fact that the person who is praised for inventing gynecology and women's
Oh yeah.
gynecology practiced on Black female slaves during
Mm-hmm.
times of slavery in order to, even come up with these grand ideas, and not to say that he didn't probably come up with some really great ideas and come up with some great facts to be able to share with us, but he did use Black women to be able to do so. The the violence
What
that has been
can I
inflicted
just say
on.
something?
Yes,
Because I
please.
want people to understand he didn't just practice on them. They didn't have any anesthesia.
Yes.
They they didn't have any anesthesia. They had no way to consent, but they also had a galley of
Mhm.
men watching their genitals be
Mhm.
mutilated sometimes just so that someone could practice stitching them up.
Yes.
And yes, did it advance medicine? Sure. Who did it benefit first, though?
Yes. Right.
It didn't benefit them. It didn't
Yes.
benefit it what and like I'm just gonna say it because there's no way to say this that I can put delicately. And if you know how, then great. Tell me about it. I will learn from you. But they used these Black women and they exploited them and they mutilated them. And they did all of this so that white wealthy women could have access to these procedures. And
Yes.
so that's what I talk about with that old school feminism, is that unless you're willing to acknowledge these things and like have these conversations, like, and those are things where, when we look at the pill, they're like, we fought for this. And I'm like, you would step on anyone. You
Yes.
would step on anyone to make the movement. And maybe, I don't know, maybe there's another universe where, or like, there's there's the metaverse. Something else is playing out somewhere else and it's not that way. But this is just something that like, this is the way it went down. I'm sorry, I
Yes.
interrupted you, but just in what
No,
you're saying,
this
I
is
just
the way
think
it went
people need
down.
to know that it was
Yes.
not just like, oh, you're going in for like something like a routine. Because I've seen people say that, like, oh, they were getting a pap smear. Like, how bad is that? And I'm like, our top, what?
Have you ever had a
Um,
pap smear?
yeah,
Do you
there's
know
that.
the
But
trauma of your first pap smear when you go in for the first time? Yeah.
yeah, yeah.
Yeah. I think that just even that part alone, the historical part of it, is why we have to talk about it, and
Yeah.
why it is so important to talk about it, especially to women of color who are often ignored when it comes
Hmm.
to their reproductive health, when it comes to our health in general.
Yeah.
So yeah, we're going to keep talking about it, guys. And if you're one of those people who is like, this is fear mongering, no, it's education. It's education. And while I am very, very happy with my life, there are things that I wish that I would have known. And we need to give people all of the information in order for them to make the right decisions for their bodies, for
Hmm.
themselves, for their futures. Because I don't know if things would be different with me now. I don't know if and I don't know what the future holds. I pray that I'm able to have as many kids as I want. I pray that I have healthy pregnancies. I'm definitely doing the things that I can do. I started doing acupuncture. I'm like really trying to heal my gut and really try to um, calm my stress and do the things that I can do. Um,
Hmm.
but there is no way to ignore the fact that this long-term use of a medication can have an effect on your body, on your mental health. Give people the information and let them do with that what they will and let them make a choice. And that is the whole reason
Hmm.
why we're talking about it. Like choice. That's the point of feminism. That's the whole point of my body, my choice. It is your choice. But in
Hmm.
order to make a good choice for yourself, you have to have the information. So,
Absolutely. Well, and you are the only person who lives in your body. So
yes.
the only one who's going to know all of the variables. I actually just had a patient recently and she was trying to make a very hard decision about a medical procedure for her pregnancy. And she's just like, I don't know, I can do this, I can do that. There's nothing emergent. And, the thing that I said to her is that one, welcome to the beginning of a lifelong journey of making really incredible decisions for your child.
Mm,
That is part of being a mother. But two, you are the only person who can know all of the variables. This is something that is very unique because of your hormones, because you have ovaries. As a woman, that should be celebrated is then you are someone who can take in all of the logical data, but you're also aware of the family dynamic of what is happening around you, what is
right.
and you are holding all of these things that it's absolutely you are the only person who can know what the right decision is for yourself, and that I think we need to be empowering women with. They may
Yes.
decide that, I'm having these painful periods and I'm going to take magnesium, I'm going to take fish oil, I'm going to exercise, like I'm going to watch like maybe what's going on with my histamine. Like there's lots of things that you can do. Or maybe they're going to say, at this place in my life, I am literally losing it. I cannot live to my full capacity. I don't even have the energy to make the good food that I know my body needs because of the ways these periods are owning me every month. And I'm going to
Yeah.
opt in the pill because I just need to get help and I need to choose that. There's no wrong decision in that. You're the only person who
Yes.
understands what's going to be the best decision. But to make that decision, you must be given all of the information. And it's what I try to provide is all of the education that I do everywhere. However, it is so, so important that you have a conversation with a medical provider who knows you intimately. And I hope that
Mm,
everybody can find that person that they partner with because they can actually guide you on what are the risk factors given your variables. Google's a scary place sometimes. That's why I
ooh.
started my website,
Yes.
drbrighten.com, to be like, go here. It's less scary.
Yes.
But it can be scary. But when you have a provider that says, hold up, for you, given your family history, given your history, given everything we know, like these are your risk factors. You can take that logical data and integrate it into everything else about your life. And still, I believe that women, given the all the information, not the information we think that like they should have and we don't want to scare them otherwise, but actually giving them the information pertinent to the decision that they need to make, they can make the right decision. And as providers, it's our job to support them when they do,
Yeah.
whether that is to take the pill for the rest of their life or to come off the pill because they just are curious or have whatever other reason. Whatever the reason is, that's their own reason and that's their decision. We need to support them. And that sometimes looks like things like, should we talk about an IUD? Should we talk about, fertility awareness methods? Should we talk about these other methods to prevent pregnancy? I think, it's not an either or question or conversation that we should be having. It's a yes and like, let
Yes.
me listen to you and then serve you with what you need.
Right. I think the family history part is a big thing because a lot of people
Oh,
wrote in
yeah.
saying, like, I have a family history of cancer, breast cancer. And, well, you go to the gyno and when you get on these pills, they say, well, it's going to decrease your risk of cervical cancer.
And
Thumbs
ovarian
up, like,
cancer.
and ovarian cancer. Isn't that great?
Yeah.
And they don't tell you about the increased risk for other types of cancer based on your family history and things like that. They don't tell you that big ass informational packet that comes with the birth control pill that we all throw away. I've never once opened it, only to open it to see how big it is and to laugh about it. Has
I'm
all of
such
those
a
health
nerd. I
risks.
read that like whole thing when
Well,
I
thank
got
God
it.
you did. Thank God you did, so you can talk about what's
Oh,
happening and what the risks are, but for the rest of us, like, I threw that thing in the trash. I'm like, bye. I'm not trying to get
yeah.
pregnant. I wanna be able to live my life. I'm in my 20s. I wanna be able to have
Yeah.
fun and, like, go on vacation and not worry about having my period, and it all sounds
Totally,
great, and my
totally.
doctor's telling me I'm gonna get pregnant right away when I get off of it, and they're telling me that I'm decreasing my risk for cancer, so everything is great. There is more. Like,
Yeah.
yes, and yes, you're gonna be able to do all those things, and you're gonna be able to decrease your risks and blah, 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 but also, there's more information there that needs to be unpacked and discovered. So, just everybody listening, just know that there is more. You need to get these books. You need to get these books. It has changed my life, truly, and I am taking your supplements also, which also are just so helpful. That was the first thing I did, was crack open the back of that book and, like, buy all the supplements because I was like, "I need to take these supplements as she's talking to me and telling me what it is that I need." So, thank you. I do want to lastly tell people what you think that they can do if they do wanna get off the pill, but they don't wanna get pregnant right now.
Yeah.
What should we be taking? What should we be doing? I know that obviously it is, subjective, but what do you think about IUDs? People are on Nexaplanon. I can't even pronounce it.
Yeah.
Nexaplanon, Depot. I don't Depop. I don't know what's going on, guys. I've just been
Deep
on the pill.
pop.
I have no idea.
I love that. Sounds like a little K-pop band or something.
Yeah,
It's the Depop.
the Depop.
Uh, yeah. So usually when people are wanting to come off the pill, they are wanting to do non-hormonal options.
Hmm.
So in Beyond the Pill, that's chapter 13 that I talk through all of that. We don't have a lot of great options.
Yeah,
We don't. And
yeah.
it is a bummer. I mean, the best option we have if you don't want to have a baby, but you do like penises, is to ask
Yes.
that penis owner, would you get a vasectomy?
Yeah.
That is one, it's definitely not going to affect you, but it's a very quick procedure, unlike, having your tubes tied.
Hmm.
But it's also reversible in a lot of cases. It's a quick in and out. Funny enough, they quick in and out. I can't believe I just said that, but I
Quick in and
said it.
out.
Uh,
No
geez.
pun intended.
No, but I'm like, did those words leave they absolutely left. They left your mouth. Oh, I'm like, good times. So
Good, good.
vasectomy, it's important to understand though that you have to have a follow-up sperm test, semen analysis, because they have to make sure it's not instant. They have to make
Mm,
sure that there's no swimmers swimming there.
yeah,
But with a vasectomy, what I was going to say is what's really interesting is that, it's a quick, relatively and relatively painless compared to most people's IUD
right.
insertion stories.
But these men
Um,
don't give a shit. They are so I
well,
mean, God, some of them
their
do.
men
Some of
do,
them do.
but their doctors will give them like heavy duty drugs. And if you go in for an IUD, they're like, you can have over the counter ibuprofen.
Yeah,
And my IUD, like I thought it was just me because I remember my friend went in for an IUD and it was fantastic for her. And she's like, I walked home after that. And I was like, cool. I never been in so much pain in my life.
yeah,
Like it was so bad, so bad. And that was with the copper IUD. So why do I share that? Is it to scare you? Mm-mm. It's to have a conversation and call bullshit on any provider who's like, the cervix doesn't have any nerve endings and like nobody fills it. It's super quick. You deserve adequate pain management. You
yeah,
absolutely do. And there are providers there that will absolutely give that to you and help you with that. So it doesn't have to be that way.
yeah.
People who get their copper IUD, when they love it, man, they love
Yeah, there's
it.
so many
So
people who love it, but I've
yeah,
heard so many horror stories of people, it falls out, it got lost, I had to get surgery, I was
so
in so much
rare.
pain. I'm like, "Oh my
Okay,
God."
okay. That's very, very rare that it's gonna like be expelled from the uterus or perforate the uterus. That's very rare. So I want people
Okay.
to understand that. Like compared to like some of the adverse mood symptoms that the package insert of birth control will list itself, like you're more likely to get depressed on the pill than you are to have a perforated uterus from an IUD. And your
Mm,
provider can certainly talk to you about like, what does your uterus look like? What's your anatomy? What are the risks for that? Same thing with like the pill, by the way. Not everybody gets sad. Some people get happier on the pill. So they can talk to you about those things. So with that, the copper IUD though, if you suspect you have endometriosis, you know you have endometriosis, adenomyosis, fibroids, you have heavy, painful periods, do not get the copper IUD. It will
mm.
not be your best friend, and you'll be pulling it like a few months later because
Oh.
it can make all of that so much worse. It causes localized inflammation, so that the uterus is basically inhospitable to a
Mm.
potentially fertilized egg. But it also is toxic to sperm, so that they cannot pass. It's like Gandalf in the uterus, like you
Yes.
cannot
Yes.
pass. So, but they last a long time. People really do love them. There are risks of like ascending infections possibly, but if you're going to be in a non-monogamous situation in your life, barrier
Mm-hmm.
methods always, always
Yeah.
and forever,
Yeah.
always and forever. Unless somebody is like having, then you move into like they get tested and we all know everything's okay. So that's
Yes.
another thing is using barrier methods. People right away, there is a whole clan on the internet who love fertility awareness method. I'm a big fan because God, like getting to know your body that intimately, and it's
Mm-hmm.
so much data that you can have. That's how I was able to get pregnant every time that I wanted to try. I'm like, I know exactly when I ovulate.
Yeah.
And you can use that. When you come off the pill though, you have to have consistent cycles for you to be able to track that data. We're looking for temperature spikes, cervical mucus changes, position of your cervix. Like you're getting all this data on your body, but you, just like your doctor was like, give it 4 months, come back and see me. It's the
Yeah.
same for fertility awareness method. And so that's one that you're going to, if that's what you want to do, and you're like, that's all I want to do, you need to have a barrier method and just be using that. Ovulation is what comes first. We always, periods day one of your cycle. We start teaching about the cycle from the period. Everything's focused on the period. Yeah, that's like, as I said, like that's not the agenda of the body. Ovulation is what it's all about.
Mm.
The period sometimes is just like your uterus being real sad about like they did not accomplish the
Yeah.
agenda.
I wish that they could just send me a note. Like just send me a text and be like,
Yeah,
I'm
just
sad. I'm
yeah,
sad you didn't get pregnant this month. Maybe next time.
yeah.
You don't got to put me through this shit. We don't have to do this whole pageantry of it all. I don't need you to bleed. You don't have to cry. Just like send me a text. But no, it's not how it
No, not at all. But everybody should know though, that if you're like, oh, I came off the pill, my period didn't come back. Oh, I could just like, so let me just say too, when you stop the pill, you're going to bleed.
Mm-hmm.
You're going to bleed. But if you're like 4 weeks out from that and you're like, oh, my period hasn't come back, I'm probably not fertile.
Yeah.
Like, wait a minute. You're going to ovulate first.
Mm.
Then you're going to see your period. So understand that you can get pregnant. And if the goal is not to get pregnant, right? If the fear is we are in the post Roe v. Wade era, then you have to know everybody needs to be educated that
Yeah.
ovulation precedes menstruation. That means if you're breastfeeding, you're not in the clear. Like there is some research showing that like, oh, in the first 6 months, I've had patients get pregnant at like 4 months
Yeah.
postpartum, which it's hard, y'all.
Yeah.
I got 2 kids. They got a big gap. I can't imagine that small of a gap, but that happens because we're not educating women. And I'm like
Yeah.
trying to warn every one of them, like you're going to ovulate. Then you'll see blood,
Yeah.
like usually about like, but it's going to be like 10 plus days later. We're going to see blood. And then for sure that you're fertile. The same thing with polycystic ovarian syndrome, with hypothalamic amenorrhea, any condition. This is not just coming off the pill, any condition where you're not menstruating regularly, but then you start doing the things to take care of your body ovulates first. So if you do not want to get pregnant, that is a crucial piece of information that every sex ed class should be teaching women.
Yes. I know condoms exist. Nobody really likes to use them, let's be honest. Who really loves it? But they do exist, so you can also use that
Mm-hmm.
option. I personally am cycle tracking, and we're doing the pull and pray method, which a lot of people love, and I do too. So that's where we are
And
right
you're
now.
also not you're also okay with getting pregnant.
Yeah.
And that's something that people also have to understand, that like when you hear something like that, I've used fertility awareness method. I have an 11-year-old and an almost 3-year-old. So they're about 8.5 years apart. And I didn't get pregnant until I decided to get pregnant. And then I got pregnant, and
Yeah.
it does work. However, what's important for people to understand in that risk for me, I was always okay if I got pregnant again. It would be okay if I
Yeah.
got pregnant. I was okay with that risk. So, fertility awareness method, it really does rival the pill when it's done correctly in
Hmm.
terms of the efficacy rate. However, when you combine fertility awareness method with the pull out method, that is now you're using the pull out method. Like,
Mm.
you're using that is 1 in 5 will become pregnant
Oh
within a
shit.
year. So this is about 20% failure. And
No
so I
shit.
just bring that up. Look, you're going to see people in the comments who are going to be like, not us. Like,
Yeah.
your man might be on his game.
Right.
Okay.
Yeah. We
Like,
trained. We
but
trained while I was on birth control. Like, just how fast can you get out? It's like the Western.
that's hilarious. Oh man. It's something that you have to be aware of, because so often I'll hear people say, oh, well, I got, my friend got pregnant with the fertility awareness method, or I'll have a patient say like, yeah, we got pregnant doing that. Tell me more about it. What did you use during your fertile window? They usually say, oh, we were doing the pull-out method. I'm like, then you were gambling with a 20% failure rate. Like, that's
Hmm.
where you were at. And
Hmm.
that's the method that you were using. Because with fertility awareness method, for everyone who's not familiar with this, you track and you predict when you're going to ovulate, and then the fertile window. Sperm can live about 5 days because your uterus said so. Okay, understand?
Hmm.
They're not amazing superheroes.
Yeah.
Your uterus is like, we'll keep you alive,
Yeah. They
sir.
like to
Like,
make friends.
yeah. And so with that,
Baby
because
sperm. They're like,
like
yeah, come
until you
on.
get here's other things they should teach in sex ed. So you don't get pregnant in your uterus. The vagina actually is like so hostile.
Mm.
That pH, because your estrogen is taking care of the lactobacilli. So estrogen, so important. It's going to help your cells create glycogen. Glycogen's a sugar. It feeds the lactobacillus acidophilus. They create acid, drops your pH, says no to the BV, no to the yeast. Like, we
Hmm.
love this. But it also, it'll mess up some sperm too.
Yeah.
So that's why semen's alkaline. That's why if you ever have odor after you have unprotected sex, that can be why. The
Mm.
alkaline state. So that's basic. I love calling semen basic,
It
but it's
is.
not. It's pretty miraculous, like what these guys can do.
Well, it depends on who it's coming
But
out of.
with
It can be basic.
yeah, that's true. Yes, the basic man has to
Yes.
his basic
Yes.
goods. So that shift in the pH, though, problematic, allows for organisms to overgrow. Like, otherwise, your vagina would have held it down just fine. So the sperm actually make their way up, and fertilization occurs in the fallopian tube. So the idea is we want to keep sperm around for 5 days, because your egg only lives 24 if you're lucky, maybe 36 if you're super lucky, but likely it's going to be 24 or less.
Mm.
And so your body conspiring always to get you knocked up, whether or not you want to, which we just do things and be like, you don't need to know that I'm not going to get pregnant, but just give me the good hormones.
Yeah.
That they're going to keep your body's like, keep the sperm around. Releases the egg travels into fallopian tube, and oh, look who's loitering,
Mm.
a bunch of sperm, which, by the way, from what we understand now with the research, like, men would always be like, oh, my swimmers are so fast, they get there, the fastest one wins. No,
Okay.
actually, the egg, they come knocking with their head hanging down, being like, ma'am, please, will you let me in? And the egg decides. The egg will actually decide who gets to be let in.
Mm.
And so that's the other thing I think we should be teaching, because it's going to take like 5 days for that fertilized egg to travel down, make it to the uterus, and then implant. Are you hearing my toddler right now?
Barely, but
Okay.
I was just like so enthralled in what you're saying, because I'm even thinking about we need to do, if you would grace us with your presence again, because we are so far over, but this is the
I
most
know. I
important
just looked at what time it is.
this is the most important episode that I think that people will listen to on this
It's
podcast.
a
At least
two-parter for
it's a
sure.
two-parter. It's very important to me too, but I want to talk about pregnancy and the intricacies and the fact that we're born with all the eggs that we're going to have in our lifetime. I'm like learning so much And I'm so grateful for all of this information, and I want to talk to you every day for the rest of my life. Um, but I also need to honor your time. So I just want to say thank you so much. Thank you for the work that you're doing. Thank you for coming on this podcast. I literally am like jumping out of my skin because I want to ask you 5 million more things, but we have to we can't do this. We can't do this all day, Dr. Brighten.
We had too much fun. We should have
We
just
had too
done
much fun.
rapid fire. We should
I
not have
know.
made eye
I know.
contact.
I know we should have done this off of camera. It would have made things so much easier. But I am just so grateful, and I feel like we covered a lot of ground. There's so much more to uncover when it comes to women's bodies, and I think that that's the beauty of it. And it can feel very overwhelming. I will say that it can feel very overwhelming, especially when you haven't had the information this entire time. But I am someone who loves to soak up the little details like a sponge, and I feel like I can use them moving forward. So hopefully everyone listening feels the same way. Like take a deep breath, get on Amazon, buy the books, you'll be fine. Just like, take a chill
Or
pill.
use your Audible credit.
Use
They're
your
going to tell
Audible
you it's
credit.
expiring soon.
Yes, exactly. No, I love the Audible book. If you want to hear Dr. Brighten's voice all the time, like I do. I listen to you when I'm working out. I listen to you when I'm in my car. I listen to you while I'm on the plane. Like I've just been soaking in everything. So for those who want to follow you and find you, where can they find you?
Brighten.com, drbrighten.com. That's my main hub. And then I'm all over social media at Dr. Jolene Brighten. And my name, Brighten. And Jolene, like Dolly sang it. I'm actually looking at
Yes.
my Dolly Parton mug right now. And I'm like, that's
I
how it is.
I have to ask you this because I was so curious when Beyonce put out her rendition of Jolene. I was like, how are the Jolenes doing? Like, how are you doing mentally,
Oh my God.
emotionally?
The thread, like on threads, suddenly people were talking all this shit on Jolene. And I was like, what is happening? Like,
Yeah.
what did I miss? And what's so funny is that the Washington Post reached out to me and they were like, oh, we'd like to interview you about your name. And I was like, this was like a week after I had like gone hard on them for their birth control piece. And I was like,
Uh, are
why?
you
Is
sure?
this a trap? This
Yes.
feels scary. Do I
Yes.
need an adult?
Yes.
But yeah, they were like, we want to interview you. And the reporter was like, yeah, you're like the biggest Jolene that we found. And I was like, oh my God, that's hilarious. Yes. And also, I will not take your man, just for the
Yes. Okay.
record. I'm
Good to know.
good. I'm busy. I don't need more problems. I'm good.
Good to know.
But yeah, they did interview me about that. And yeah, it's like, Beyonce has got like teeth. She's like,
Yeah.
but you know what we need? I was like actually listening to Beyonce's and I was thinking what we really need is to like Dolly or Beyonce or whoever it is to gang up with Jolene. Like that man. Like I want to
Yeah.
hear that like what if we have a conversation?
Yeah.
And I wasn't actually trying to come for him. Like maybe I was flirting with him because I felt really uncomfortable. Like
Yeah.
who knows?
Or
Like what's
maybe he
happening?
told you that he was single. Maybe he told
Maybe
Jolene
he
that
did.
he was having problems in
Yeah.
his marriage, as they often do. Like, why are we blaming Jolene? Because she's
Yeah.
beautiful? Come on, guys.
Yeah.
We have to dial it back.
Yeah.
But that's so funny. I love that. I'm like, are the Jolenes okay? Like,
It was
this
just
is
really
like
odd too to
unfair.
be like, you want to interview me about my name?
Yes, yeah. Out of all
Yeah.
the things that you do and talk
Yeah.
about, they're like the
But
name.
like it's a pretty awesome name because this is something I did share in it is just that like if I go to like so I lived in Portland, Oregon for over a decade and I don't know, maybe there's just a lot of theater people who are baristas, but they would always sing my name for like my coffee order. Like I went to a
Oh,
bluegrass festival. I actually was working in a bluegrass festival and I was like I don't know, I was like in the t-shirt booth and one of the performers found out that was my name. So he decided to like perform Jolene at the festival because there's a Jolene here. Like things like that, that
wow.
I'm like, like I will say that like most of my life, well, no, because I'm a lot older now. So like the early years, it was super cringe. It was
Yeah.
so cringe. And like when you have a substitute teacher and they're like, let me sing this name, and you're
Oh
like
my
dying
God.
in your seat in class, and you're like, I'm already an awkward teenager that I don't want people looking at me. And now you
Yeah.
made sure every like, thanks, sir.
Yeah.
Appreciate that. But then as I look back, I'm like, everybody's having a good time.
It's
They're all having a
iconic.
good time singing that song. And like,
Yeah.
for whatever reason, I step into the room and like suddenly they got this like joyful moment and like let it be. And I'm
Yeah.
like, that's pretty awesome. Not a lot of people can say that about their name.
It's iconic. I just imagine you introducing yourself as Jolene to someone and them being like, please don't take my man. And you being like, okay, I won't.
They
Don't worry.
have. Oh,
Nobody
it's like,
wants
and it was
him.
like always old people. It was like
Yeah.
always old people making those kinds of jokes. And I'm
It's
just
so
like,
funny.
"Ugh, are you
Yeah.
talking about Dale over
Yeah.
there? Like, ugh."
He's on an oxygen tank. So pretty sure he shouldn't be taking anything in but
Yeah.
oxygen. Don't worry.
Yeah. Just keep the
Oh my
brakes on. I can't take him anywhere. He's gonna be
God.
fine.
That's so funny. Dr. Brighten, thank you so, so much from the bottom of my heart. I am so appreciative. Thank you.
Yeah, thank you. This was such a fun interview. We covered
Yay.
so much too.
So much ground, guys. So much ground. If this is two parts, don't kill me. I'm just trying to give you all the info. Okay? I'm just trying to give you all the info. And also, if you do get pregnant because you got off birth control, do not come to me, but you can name the baby after me and Dr. Brighten. We will take it.
No, please. I don't want to. Let me have Jolene. I'll take, fine. I'm taking the man. That's my legacy. But like unintended pregnancies, no, like, no, no, no.
Yes, okay. Just give them my name then. It's fine. Bye.